Before beginning morning care, the CNA should first A. Close the room door and start bathing. B. Greet the resident and explain each step. C. Gather supplies and begin immediately. D. Turn off the call light and continue care. Answer: B. Communication and explanation before care help establish trust and maintain resident dignity. A resident who has Parkinson's disease has difficulty feeding himself. The CNA should A. Rush the meal to avoid frustration. B. Offer adaptive utensils and encourage self-feeding. C. Feed the resident completely. D. Cut food into large pieces. Answer: B. Promoting independence with adaptive utensils supports dignity and motor function. The CNA notices a resident's urinary output is dark and has a strong odor. The CNA should A. Add more water to the urine container. B. Report this observation to the nurse. C. Ignore it unless the resident complains. D. Discard the specimen quietly. Answer: B. Unusual urine color or odor may indicate infection or dehydration and must be reported. When repositioning a resident in bed, the CNA should A. Pull the resident by one arm. B. Lower the bed to the floor. C. Use a draw sheet and proper body mechanics. D. Twist at the waist for leverage. Answer: C. A draw sheet and correct body mechanics prevent skin injury and caregiver strain. The most important step in preventing infection during catheter care is A. Wearing gloves and washing hands. B. Keeping the catheter above bladder level. C. Pulling on the tubing gently. D. Using hot water for cleaning. Answer: A. Hand hygiene and gloves are key to preventing catheter-associated infections. When a resident refuses care, the CNA should A. Force the resident for safety. B. Document the refusal and notify the nurse. C. Leave without documenting. D. Ask another resident to help. Answer: B. Residents have the right to refuse care. The CNA must document and report to the nurse. Which of the following demonstrates respect for resident privacy? A. Keeping the curtain open to watch the TV. B. Closing doors and curtains during care. C. Leaving the resident uncovered for convenience. D. Talking loudly during care. Answer: B. Maintaining privacy with curtains or doors closed promotes resident dignity. A CNA suspects a coworker is verbally abusing a resident. The CNA must A. Ignore the situation to avoid conflict. B. Report it immediately to the charge nurse. C. Confront the coworker alone. D. Wait to see if it happens again. Answer: B. CNAs are mandated reporters and must report suspected abuse immediately. When assisting a resident with dentures, the CNA should A. Use hot water to clean them. B. Store them in labeled container with cool water. C. Place them on a tissue. D. Keep them on the bedside table. Answer: B. Dentures must be kept moist in cool water and properly labeled for hygiene and identification. When taking a radial pulse, the CNA should A. Use the thumb for better grip. B. Press firmly on the artery. C. Use 2 or 3 fingertips lightly. D. Count for 10 seconds only. Answer: C. Fingertips detect the pulse best. The thumb has its own pulse and may distort accuracy. To reduce fall risk during ambulation, the CNA should A. Keep the floor waxed and shiny. B. Encourage loose footwear. C. Use a gait belt and non-skid shoes. D. Pull the resident's arm for support. Answer: C. Gait belts and non-skid footwear ensure stability and safety during walking. A resident on a thickened liquid diet asks for regular water. The CNA should A. Give them the water if they insist. B. Inform the nurse about the request. C. Dilute thickened liquid instead. D. Ignore the resident. Answer: B. Residents on special diets must not receive restricted items without nurse approval. The best way to handle soiled linens is to A. Shake them to remove debris. B. Hold them close to your uniform. C. Carry them away from your body. D. Place them on the bedside table. Answer: C. Linen should be held away from the uniform to prevent contamination. A resident with dementia starts to wander during meals. The CNA should A. Physically block the door. B. Gently redirect the resident back to the dining area. C. Restrain the resident in the chair. D. Ignore the behavior. Answer: B. Redirection is a safe and respectful technique for residents with cognitive impairment. A CNA finds a fire in a trash can. The first step is to A. Use the nearest phone to call 911. B. Run to find the supervisor. C. Remove residents from immediate danger. D. Pour water on the fire. Answer: C. The RACE procedure starts with rescue, remove residents from danger first. Which of the following is an example of a psychological need? A. Clean bedding. B. Fresh water. C. Feeling loved and accepted. D. Proper lighting. Answer: C. Emotional and social support fulfill psychological needs, crucial for resident well-being. When a resident is on oxygen therapy, the CNA should never A. Place oxygen tubing behind the ears. B. Use petroleum-based lotions near the nose. C. Check for kinks in the tubing. D. Observe for skin irritation. Answer: B. Petroleum products are flammable and unsafe around oxygen. Which of the following promotes better sleep for residents? A. Loud television. B. Providing a quiet, comfortable environment. C. Serving coffee before bedtime. D. Leaving bright lights on. Answer: B. Calm, dark environments support natural sleep patterns. When recording a resident's temperature, the CNA should A. Round to the nearest whole number. B. Record exactly as displayed. C. Estimate if unsure. D. Use the same value daily. Answer: B. Accuracy in charting is essential, always record exact readings. A resident's family complains that call lights are not answered quickly. The CNA should A. Explain that staff are too busy. B. Listen and report the concern to the nurse. C. Argue that it's not true. D. Ignore the comment. Answer: B. Listening and reporting concerns demonstrates professionalism and accountability. When giving a partial bed bath, the CNA should wash A. Face, hands, underarms, back, and perineal area. B. Only the resident's face. C. The full body. D. Only visible areas. Answer: A. Partial baths focus on key hygiene areas for cleanliness and comfort. The CNA observes a small bruise on a resident's arm. The correct action is to A. Ignore it unless it gets worse. B. Ask the resident how it happened and report it. C. Apply ointment. D. Cover it with gauze. Answer: B. Observations and resident statements must be reported to ensure safety and documentation. Which of the following prevents aspiration during feeding? A. Feeding quickly. B. Positioning the resident upright at 90 degrees. C. Laying the resident flat. D. Offering large bites. Answer: B. Upright positioning reduces risk of choking and aspiration. When transferring a resident with a mechanical lift, the CNA must A. Work alone for efficiency. B. Follow manufacturer instructions and facility policy. C. Move quickly to save time. D. Pull the resident manually into sling. Answer: B. Safety protocols ensure correct operation and prevent injury. A resident's blood pressure is significantly lower than usual. The CNA should A. Retake and report immediately to the nurse. B. Wait until next shift. C. Record normal reading. D. Ignore the result. Answer A. Unusual vital signs require prompt recheck and nurse notification. Which of the following is true about perineal care? A. Always wash from back to front. B. Use cold water only. C. Wash from front to back. D. Avoid using soap. Answer C. Washing from front to back prevents transfer of bacteria from rectal to urinary area. When assisting a resident with one-sided paralysis to dress, the CNA should A. Dress the strong side first. B. Dress the weak side first. C. Remove clothes from the weak side first. D. Wait for the nurse to assist. Answer B. Dress the weak side first to reduce strain and discomfort. During foot care, the CNA should never A. Dry thoroughly between toes. B. Soak feet for more than 5 minutes. C. Trim toenails. D. Inspect for redness. Answer C. CNAs should not trim toenails due to infection risk, especially in diabetic residents. A resident begins to have a seizure. The CNA should A. Hold them tightly. B. Clear the area of hazards. C. Place a spoon in their mouth. D. Restrain the arms. Answer B. Protect from injury by clearing surroundings, never restrain or insert objects. When assisting with range of motion (ROM) exercises, the CNA should A. Move joints quickly to finish faster. B. Stop if the resident feels pain. C. Force the joint to full movement. D. Do all exercises at once. Answer B. Pain indicates potential injury, always stop movement immediately. A resident with diabetes complains of dizziness. The CNA should first A. Offer water. B. Report immediately to the nurse. C. Let the resident rest and ignore. D. Take them for a walk. Answer B. Dizziness may indicate hypoglycemia, notify the nurse promptly. When providing postmortem care, the CNA should A. Rush the process. B. Treat the body with dignity and respect. C. Remove identification bands. D. Leave soiled linens. Answer B. Respect and dignity must be maintained even after death. The CNA observes another aide taking a resident's belongings. The CNA must A. Ignore it. B. Confront privately. C. Report the incident immediately. D. Ask the resident about it later. Answer C. Theft is abuse and must be reported without delay. When using restraints, the CNA should A. Tie them to movable parts of the bed. B. Use the narrowest strap possible. C. Check circulation frequently. D. Leave them until next shift. Answer C. Circulation must be monitored to prevent injury from restraints. A CNA overhears staff discussing a resident's diagnosis in the hallway. This violates A. Infection control. B. HIPAA and confidentiality. C. Fire safety rules. D. Facility visitation policy. Answer B. Discussing resident information publicly violates confidentiality laws. When emptying a urinary drainage bag, the CNA should record A. Approximate amount. B. Exact measurement and color. C. Only time of drainage. D. Nothing unless it smells. Answer B. Accurate output and appearance are essential for monitoring fluid balance. The CNA can help a depressed resident by A. Forcing them to join activities. B. Listening and encouraging gentle participation. C. Ignoring their feelings. D. Giving medical advice. Answer B. Supportive listening encourages emotional well-being and social interaction. A resident complains that food tastes bland. The CNA should A. Add salt or sugar secretly. B. Offer condiments if allowed. C. Tell the cook to change the recipe. D. Ignore the complaint. Answer, B. CNAs can offer approved condiments but must not alter diets. When assisting with oral care for an unconscious resident, the CNA should A. Pour water freely. B. Use minimal liquid and position head to the side. C. Place dentures in mouth. D. Lay the resident flat. Answer, B. Side positioning prevents aspiration during mouth care. To prevent pressure injuries, the CNA should A. Reposition residents at least every 2 hours. B. Leave residents in one position for comfort. C. Apply talcum powder frequently. D. Massage reddened skin. Answer, A. Regular repositioning maintains circulation and prevents skin breakdown.